Hi, I'm Linda. I'm a UK registered nurse, and today we are here to talk about falsifying observation. It's one of the professional value topics you'll be getting in OSCE. So usually they'll give you a scenario. Say you are in a ward or in a care home, and then you see your colleague nurse not take a patient observation, but comes to document that this is the value he or she got, and then you are aware of this. What are you going to do? So basically they just want to see what you will do. If you check in the marking criteria, you realize that most of the points have been listed in bullets, but when you are presenting your answer, you have to do it as I will, because the question is asking you what will you do. So now when we take this particular topic, you're going to say, first of all, you have to recognize that your colleague has falsified an observation. So in this case, you write it as I will recognize that my colleague has misinterpreted or not taken the observation but has falsified it. Then what would you do if you have acknowledged that your colleague has done that? Then I would identify that I have to go and take the observation to be sure of what value it is. So you go and take the observation, assess the patient's vital signs to ensure that the patient is safe. Then what would you do? You have to document. So in the UK, everything you do, you need to document. So you document the event. So I will document the event or things that have happened, and then the consequences of the event, okay, in the patient's record. So maybe at so and so time, so and so did this and this and this, did not take patient observation, however recorded that he did this. So you record that, and then you need to fill an incident report. So here, everybody here knows that everything that happens, you have to fill the incident report. Then it's part of your professional duties. That's the fourth point. You have to acknowledge. So I will acknowledge that it is part of my professional duty to report what my colleague has done. So you report your colleague's dishonest behavior, because what he has done is dishonest. So you need to report it, because if he does that to someone else and nobody is there to see, you know what the actual consequences of this action can be. So you need to acknowledge that it is your professional duty or responsibility to report this. Then you have to also report your concerns to your manager. So here I would report these concerns to my manager at the earliest opportunity, either in writing or I can do it verbally. And then the sixth point is, as a nurse, in everything you do, you need to uphold the code. Now, what is this code? You prioritize people, you practice effectively, you preserve safety, and you promote professionalism and trust. So you can't just write, I'll uphold the code just like that. Maybe you may want to explain further in the points what exactly you are doing when you are doing that, when you talk about the code. And usually, I think if you get about 5 points, you can't get below 5 points. You need to get 5 and more. So if you get about 5 points going, that's good for you. And I would encourage all of you to subscribe to Nurses 2 Kids. We've got lots of exciting topics to talk about. If you're already a nurse in the UK who is thinking, oh, I'm done with OSCE, I don't really need Nurses 2 Kids, that's not true. We've got exciting things about career growth, a whole lot, how to manage certain cases or situations when they happen at your workplace. You've got lots of this coming for you. And for those who are here to write the OSCE, this is the channel for you to subscribe to, okay?